Hi, my name is Lauren and I'm Margaret's nurse. I would like to go over some things with you before we discharge Margaret, and at the end of our conversation, you will be able to identify some risk factors that can cause falls in adults with dementia, and hopefully we can prevent any future falls for your mother. So to start, what do you know about risk factors for falls and dementia? Nothing? Okay. So adults with dementia are at a high risk for falls. There are many things that can contribute to a fall, like a history of falls, such as Margaret, being unsteady when walking, different medications, and hazards in the home. Does this make sense to you? Yes? Great. So could you please list back to me some of the risk factors I've just mentioned? Here's a great online resource I think would be beneficial to you, to your husband, to your mother, and that in the future you can use it as reference. On the paper I've just handed you is the website address. It's important to remember that Margaret, especially since she's going to be healing from her hip surgery, might have an impaired gait. She might walk slower than usual or be a bit unstable, even wobbly on her feet. Also, she's taking several different medications, and each of these alone or in combination can cause her to be drowsy or dizzy or both, and these can both contribute to falls. Also, environmental hazards, some things that you might not even think of, can contribute, such as a rug in the hallway or a lack of handrails in the bathroom, might cause a fall. Now, can you tell me in your own words the risk factors I've just talked about? Great. So I have this risk assessment poster that I think is applicable to your mother's care. Can you please take a look at it and tell me if you can think of any more risk factors that we might not have discussed? Vision loss? Yes, for sure. That can definitely contribute to falls. Now, I'd like you to think about your mother's home. Tell me if there are any risk factors that you can think of. She has a rug in her living room and no seat in the shower. Absolutely, I agree. Those are both risk factors that might cause your mother to fall. What do you think the safest thing to do would be? Yes, I think removing the rug would be a great first step. And I think you should contact the Community Rehabilitation Center through BC Ministries and have an occupational therapist come and assess your mother's home. Here's the website address so that you can do that. Do you have access to a computer? Okay, great. So when you get home, you'll be able to access those websites I've provided? Perfect. So to finish, could you please now teach your husband here how he could help identify risk factors that might contribute to a fall? Perfect.